Good evening. Welcome back to another episode of Bread and Butter Primary Care with Dr. Stokes. Today we're switching gears to another subject. Today's video is diabetes. What is it and why do we care? And so this is a big one. Diabetes is a huge problem in the world and in the United States. Very, very commonly occurring, and a lot of information about diabetes. There's type 1, there's type 2, there's insulin and pancreas and all this information. There's dozens of different medications, pills and injections and all sorts of things that happen surrounding diabetes. And so I'm going to do a whole series about what diabetes is, the difference between type 1 and type 2, how to prevent it, how we treat it, all those types of things. This first video, I just want to be a brief introduction, very basics as far as what is diabetes and why do we care. What does it do to us? Why is it important? I'll state from the get-go that there's actually several different disease states that are referred to as diabetes. Generally speaking, when you hear diabetes referred to, just when people are talking about it, they're talking about diabetes mellitus, which is the sugar diabetes. There is a diabetes insipidus, which is a completely different disease state with completely different things. It shares a name for a reason we won't get into right now, but I just wanted to clear that up from the beginning that we're talking about diabetes mellitus, or the sweet or sugar diabetes. And so let's get started. What is diabetes and why do we care? So in order to understand diabetes, we have to understand a little bit about what our bodies do with sugar. So sugar is an important molecule for our bodies. It is the source that is used to form energy. So the way that we function, our cells move around, our blood flows, our temperature stays at the right state, all this inner motion is run by energy sources, and that energy is built by the cells using glucose or sugar. So our cells, our tissues, the fat, the muscles, the skin, the nerves, they need sugar, glucose, in order to form the energy packets that they then use to perform their functions. And so diabetes is an aberration in the way we metabolize and deal with sugar. So something's wrong in how we deal with sugar, and that's what we call diabetes mellitus. I got a prop with me today to help demonstrate this. It's just a piece of Play-Doh, but I've hollowed it out in the middle. And so I want this to represent an artery. So inside here would be where our blood flows. So the heart pumps and blood is flowing through the artery. You can imagine maybe it's in my arm. Okay, so the blue, everything that's blue is our tissues, the muscles, the fat, the skin, the things that surround the artery. So blood is flowing through here, and this in between my fingers is the body, the tissues. We don't need, or the sugar initially is in the blood, it's right here inside the artery, but it needs to get into the actual Play-Doh. The cells need to take the sugar into themselves to then form it into energy so then it can be used. So diabetes, whether it's type 1 or type 2, and there's another video about the two types and how they're different. But diabetes is a problem getting the sugar from inside the blood, flowing through the arteries, and into the tissue. Okay, so that transfer has to happen. We eat sugar, it goes into our stomachs, it breaks down into individual glucose molecules, and then it's flowing in our blood. And then it needs to get out of the blood into the cells and the tissues. And diabetes, whether it's type 1 or type 2, is when there's something wrong with that process. The sugar just stays in the blood. It doesn't go into the tissues. And so that's why if you're a diabetic and you prick your finger and you test your blood sugar, it'll be high. Because most people whose bodies are working normally, who don't have any type of diabetes, there's a certain amount of sugar in the blood. Anything above that amount is taken up into the body and used by the tissues. But with diabetes, that transfer can't occur, so it just flows in the blood. So you check your sugar when you're a diabetic, and it's 200, it's 300, it's 400, much higher than what it's supposed to be, because the sugar just doesn't have anywhere to go. It can't get into where it's needed. So that causes a few problems, so that leads us to why do we care? There's two issues with that. One, if the sugar can't get into the tissues, then they can't use it. And so then they don't make the energy they need, and they can't function as well as they should. And two, the presence of that extra sugar inside the vessel, the presence of the sugar inside here, causes problems because it's not supposed to be there. One way to imagine this, and this is an oversimplification, but it's helpful to think about it functionally, is that sugar is almost like these little ninja stars, these little sharp, spikes that are floating around in the blood. And when there's more of them than there should be, they stick to the blood cells. And so instead of a nice, you can imagine, instead of a nice smooth red blood cell flowing through your artery, you've got a red blood cell with a bunch of ninja stars stuck to it, these sugar molecules. And so as that blood cell flows through the artery, it's sharp and dangerous, and it cuts and damages the arteries, which then makes them get tighter and stiffer, and over years of time, that leads to higher rates of heart attacks, strokes, etc. So if you've seen the video on hypertension and why do we care, cholesterol and why do we care, the why do we care about diabetes is in part the exact same problem. The presence of that sugar inside the vessel is damaging the artery walls, it's increasing inflammation, and it's making it so instead of nice, healthy, bouncy, elastic arteries, we're getting these stiff, thin lead pipe arteries that can't accommodate a blood clot, they can't accommodate a plaque. So if those things happen, you end up having heart attacks and strokes and those types of things. So what is diabetes? It's an inability of the sugar to get from the blood fluid into the tissues of the body. It can't make that transfer. Why do we care? Because that extra sugar sitting in the blood fluid damages our arteries. It damages, makes them more stiff, and then the end tissues, the nerves and the kidneys and the eyes and the feet that need blood don't get it because the sugar has damaged the vessels. It's a problem that takes place over decades of time. And so not knowing about it, not treating it, letting it go for a long time is increasing your risk of problems in the future. So that's what diabetes is. That's why we care. Please stay tuned for future videos about type 1 and type 2 with more details about diabetes. Why do we care? Thanks for your time. This is Dr. Stokes with Bread and Butter Primary Care.